Hello there, and welcome to my video. Today we will discuss recognizing and reporting changes in health circumstances. The information in this video was taken from the Providing Residential Services in Community Settings, a training guide curriculum, which is the approved curriculum for direct care staff in certified adult foster care facilities. This curriculum was a collaboration of multiple departments and individuals knowledgeable and experienced in areas outlined in the curriculum. The curriculum, as a foundational guide, continues to be applicable. Let's get started. Emergency conditions. Emergency conditions may arise from a great number of different causes: injuries, illnesses, and complications, including unwanted effects of medications. There is no rule to follow in deciding what is and what is not an emergency situation. Common conditions includes excessive bleeding which you are unable to control, obstructed airway, as in choking, failure of the respiratory system, respiratory arrest, failure of the circulatory system, a heart attack, and loss of consciousness unrelated to predictable seizure activity. Your job is to react swiftly to any emergency condition, using your skills in first aid and CPR for temporary life support. Emergency conditions are those thought to be of an immediate life-threatening nature. Call 911 immediately. Talk calmly, slowly, and clearly. Answer any additional questions the emergency operator may ask. Be sure to give the exact address and location of the emergency. Do not hang up the phone until the emergency operator hangs up or tells you to hang up. It is the caregiver's responsibility to support the physical well-being of the recipient while securing the appropriate medical assistance. When more than one staff person is involved, one person must take charge of the situation. This person is responsible for telling others what to do and for providing immediate emergency assistance. Other staff members should call 911, help administer first aid or CPR if necessary, and gather the Medicaid care, permission for treatment form, medical records, and blank forms so that the doctor who treats the person will have complete information. If you are the only staff person involved, you will have to deal with the emergency on your own unless bystanders or other consumers are able to help. Remember, your primary responsibility is to see that 911 is called and to provide emergency assistance to the person until help arrives. Accompany the person in the ambulance to the hospital with all the necessary information and forms. If an ambulance is not available, you may have to transport the person to the emergency room on your own. Be sure to notify the hospital that you are on your way and explain the nature of the emergency and about how long it will take you to arrive at the emergency room. Stay with the person in the hospital until relieved by other staff or released by your supervisor. Return to the group home with the person if he or she is not admitted to the hospital. Be sure to document all of the details of the emergency, including medications and orders received and follow-up treatments required. After the emergency is under control, call your supervisor if he or she has not been notified earlier. Inform the person's doctor and the nurse consultant for the home. And finally, be sure to communicate all of the necessary information to other staff.